How are you doing, sir?
Very fine, and you?
I'm so good, thank you, sir.
That's good.
So please, can we meet you? What's your name?
Okay, I'm Dr. Eustace Osegale. I'm an ENT surgeon, ear, nose, throat, head, and neck surgeon. I work with UBTH where I'm a consultant ENT surgeon.
All right, thank you very much, sir. Basically, we're going to be talking about what hearing impairment is all about. We want to enlighten a lot of people out there. So, what is hearing impairment? What's it all about?
No, hearing impairment is as simple as it is. Problem hearing, impairment of hearing, challenge with hearing. That means the person cannot hear well. That's what hearing is all about. Hearing impairment is all about. God gifted us with the ability to hear. Hearing is one of the senses the normal person should have. Or for whatever reason, for some reasons, some people have a challenge with their hearing. They can't hear well. When you talk to them, they don't hear. For some, they don't hear at all. For some, you have to shout for them to hear. So if we are going on with this hearing impairment, simply put, you can say hearing loss. The person can't hear well. He has lost his sense of hearing, or the sense of hearing is reduced. And there are two types of hearing loss, basically. There's the conductive hearing loss and the sensorineural hearing loss. I don't know how much time we have, but I'll just try and be very fast and simple.
Right.
The hearing, the physiology of hearing, there's the conductive part and there's the sensory or the neural part. Neural part, what that means is that the sound comes from the air or the atmosphere, as the case may be, and hits the eardrum. From the eardrum, it is transmitted to the middle ear. From the middle ear, it goes to the inner ear where there's the sense organ of hearing. From the sense organ of hearing, it goes to the brain where the speech is interpreted. What this means is that along this path, as the sound is traveling, it can have a problem anywhere. And at any point there's a problem, there could be a problem with hearing. So if the problem occurs before the sense organ in the cochlea, that's the end organ of hearing, the organ of Corti, it's a conductive hearing loss. If, for example, there's a bean seed in somebody's ear, you don't expect somebody with a bean seed in his ear to hear as much as somebody without a bean seed in the ear. So that means that bean seed has blocked the conduction of the sound. If it's not a bean seed, it's wax. God put the wax there to protect the ear. By the time the wax gets too much for some activities people may even engage in, and the wax may kick and block the external auditory canal. And so that means somebody that has wax blocking his ear, another person that don't have wax blocking the ear, that ear with wax blockade will not hear as effectively as the one without wax blockade, obviously. That's another form of conductive hearing loss. Then some people may have a hole in their eardrum called tympanic membrane. The hole may be from an infection, maybe from a slap, let me say dirty slap, so to speak. An angry husband or an angry father slapped the child, you didn't do well, slap, and the eardrum got ruptured. A woman angry with the husband, why are you coming home late, beat up the husband, and there's a perforation in the eardrum. Definitely that eardrum with the perforation will not even hear as well as the other ear in the same person without a perforation. That means that's another form of conductive hearing loss. That will affect the conduction of the sound to the inner ear. Then, if for whatever reason the end organ of hearing, is housed in the cochlea, the organ of Corti, if anything causes it to have a problem, it could also affect hearing. And it comes to reason that the hearing that is affected by the organ of hearing itself, the end organ of hearing, the organ of Corti, will be worse than the one that maybe a bean seed is covering the ear. You can easily remove the bean seed and the person will hear. You can even easily remove the wax and the person can hear. But the one in the inner ear that affects the organ, the sense organ, will definitely be worse and more difficult to treat. That's a sensory type of hearing loss. Then there's a nerve from that organ of hearing to the brain. It could also be affected. The vestibulocochlear nerve. That one too, it can be imagined that it will also be quite difficult to treat. So I've tried to talk about how the different types of hearing loss come about. There's the conductive type, which could be from anything occluding the pathway of hearing. There's the sensory type, which it could be damage to the organ of hearing. Things that could damage the organ of hearing are many. From ototoxic medications, there are some drugs you take that are not good for hearing.
Like drugs like what?
Gentamicin, quinine, there are a lot of them. We call them ototoxic medications. At the back of any leaflet, drug leaflet, they usually say if the benefits outweigh the risk. At times, the benefit may be minimal. There may be other drugs that are options for a drug that can damage the ear, but the dispenser may not know. Especially people who just cross the road and buy drugs from the chemist. The chemist man is not so screwed to know that this drug, a lady comes out, has an itching vagina, for example. The itching vagina may just be candidiasis, a fungal infection. She crosses the road and the chemist man starts giving her gentamicin injection, high doses, just to kill a fungal, high doses of gentamicin injection. And at the end of the day, the 19-year-old girl gets deaf. You understand? We've had more than several cases of such. So, but you do blame the chemist man, he doesn't know so much. And do you blame the female, the 19-year-old girl female that went to meet her? She doesn't also know so much. So
persons ought to, before giving out drugs or selling drugs, there ought to be like a prescription. Like, we can't sell certain drugs. It's not like saying you're going to buy painkillers. You know that's basic.
You mean over-the-counter drugs?
Yes.
They should be over-the-counter. But we've seen chemist men doing abortions even in their chemists.
So one way or the other.
So there's a problem in the system that the system is not really checking some of these things. You should not. There is a pattern. Well, that's another story.
Exactly.
Let's not go into all of that. There's also the hearing loss of aging that also could affect the end organ of hearing. We call it presbycusis. As we age, we expect all organs of the body to age along with us. So the ear is not spared. So it could be presbycusis, which is age-related hearing loss. Then there's one that is also of great importance: noise-induced hearing loss. Induced hearing loss. So March 3rd was World Hearing Day. ENT surgeons, especially audiologists, are still in the mood, still in the celebration mood of the World Hearing Day. The theme of this year's celebration was to hear for life, listen with care. If you think deeply about that sentence, to hear for life, listen with care, it means if you want to hear it when you are old, you want to hear well when you are old, stay away from very loud music, listen with care. So that was the theme of this year's celebration. Recreational noise. Some people from parties, they develop hearing loss, too much loud noise. Some people from earphones they develop hearing loss, too much loud noise. Some people, not even their fault. They have to earn a living. And where they work in a mill, the noise from the mill is too much. They develop hearing loss.
But is there something for persons who work in such establishments? Is there something they can do to, like, okay, yes, I'm exposed to this sort of noise. Is there something they can do to, like, how will I put it? So yes, I'm exposed to this, but this is what I can do to cause a balance. Like, okay, yes, I will not really be at the receiving end of such.
Yeah, it shouldn't cause harm in the near future.
Yes.
Very right. There are so many things they could do, from protecting themselves from the loud noise, like wearing earplugs or earmuffs. At times, even something as simple as cotton wool can protect the hearing, to regulating the noise in the environment. In more serious climes, in more developed societies, they have what they call noise regulation. I shouldn't, because I'm staying at First, for example, I don't mean noise in First because we're in First, but I'm staying in First and everybody there has a generator and some other people have grinding machines. I shouldn't become deaf in 10 years' time because I live here.
Yeah.
No, so in other parts of the world, there's permissible noise level. There's the amount of noise that is allowed in different places, and there's the amount of time you're exposed to a certain amount of noise. Because another thing that does the damage is your duration of stay in a very noisy place. In one country, for example, once the noise is 90 decibel, you can only stay there for at most 8 hours a day and 5 days a week. And for every other 5 decibel increase, your duration of stay is halved. So if is 95 decibel, that is the noise level at that place, you're only allowed to stay there for 4 hours. In more serious places too, if you work in a company where a lot of noise is emitted, you must have hearing screening at least annually. Some even say every 6 months. Every 6 months or 1 year or yearly, they check your level of hearing, whether your job has affected your hearing level. If they notice that the job is affecting the hearing level before it causes a permanent damage, you are moved to a place where you won't have so much noise, or they think that the level of protection they are offering is not the best, they increase the level of hearing protection they are offering. And such companies provide hearing protection for their staff and see to it that they wear them compulsorily. And these things are very cheap. 2,000 naira, 1,000 naira, 1,500. Yeah, earplugs, earmuff. Person just wears it. It greatly reduces the noise that the person has to face, and so prevent damage to the organ of hearing. If the person is so poor and can't afford 1,500 naira for earplug, even a cotton wool, it may not do as good as an earplug, but a cotton wool plugged into the ear will also reduce the damage until the person's boss can afford to get him an earplug. I'm aware the Nigerian Army, for their soldiers going to the show to fire, going to, what do they call it now, learning how to shoot, going to firing lessons or shooting lessons. They get them earplugs to wear so that they do not have untoward effects from the shooting exercises. And that's what every company having that should do. Even at churches, you see some people, they just stay near the speaker. Maybe they are not informed, and at the end of the day, they come down with hearing loss. So the theme this year was, like I said, to hear for life, listen with care. And the target of policymakers, young adults, the policymakers, because they are the ones that will regulate noise exposure. They are the ones that will insist that companies provide earplugs and hearing protection for their staff. Because if you leave some businessmen, some capitalists, they don't even want to spend that amount. They are the ones that will insist that staff working in mills or where there's loud noise have hearing screening at least annually. Even before that, they should have hearing screening before they take the job. Because if somebody's hearing was already at baseline, was already borderline, and now starts going where there's a mill that makes so much noise or a plant generator, the hearing will just be knocked off completely. Policymakers, because we want to appeal to insurance facilities, like we are in Edo State, the Edo Health Insurance Commission. You see what they are doing. There's been a lot of coverage on their side. We want to talk to such people that things like earplugs and earmuffs should be part of their routine. We want to talk to them that their healthcare providers that they use, they should educate them on preventing hearing loss. As their reach is increasing, they should also help us disseminate information.
Speaking of helping people, you said a lot about ways we can prevent hearing loss. There are some persons I've spoken to, they can't really hear. You tell them, oh, please come close, I can't really hear well here. Please come to this other side. What can they do to manage the situation? Because is there a cure?
Yes, a very good question. First, like I said initially, there are different types of hearing loss. There's the conductive, there's the sensorineural. I've had a patient that had wax impaction, and I just got the wax in the ear syringed out, and she was like, thank God I can now hear. I thought I was deaf. All we just did was to flush out the wax in the ear, and the person could hear. So something as simple as that. There are some other hearing loss that are not amenable to any of that. The person must get a hearing aid. A hearing aid is like an amplifier. It increases what you have, the voice increases pitch for the person using it to hear. It now seems as if other people are talking with loudspeakers when they are wearing a hearing aid. There are some that are not even amenable to hearing aids. The patient may benefit from a cochlear implantation. That's the end organ of hearing. There is some electrodes are implanted there to serve as the end organ of hearing. An expensive surgery, about 6-7 million naira.
Wow.
And it's not done everywhere.
So what are the measures people can take to prevent this hearing loss?
Okay, very lovely question again. Like our people say, what we grow up knowing is prevention is better than cure. So I'm sure that's why you're asking that. There are a lot of things. I've mentioned some, but maybe not specifically targeted at your question. First of all, as much as we can, we should avoid undue noise exposure. If you must be in a place where the noise is very loud, wear an earplug, protect the ear. Undue noise exposure could be very harmful to the ear. Then there are drugs that are ototoxic that could, like I mentioned, that could damage hearing. Let's, as much as possible, desist from taking those drugs. So what that means is that if you are not a doctor, you may not even know the drug that is ototoxic. Let's, as much as we can, stay within prescribed drugs. Because very few no doctor is going to prescribe a drug that will hurt anybody. So let's, as much as we can, stay within hospital or doctor prescribed medications. Then trauma is another thing. Injury to the ear is another thing. Yes, that could from a slap to the ear, to a punch to the ear, to cutting board in the ear, to toothpick in the ear. Some people use toothpick to clean their ear. Some people use nails to clean their ear. How crazy is that? So I've seen more than 5 people who've perforated their ears while cleaning their ears, some with toothpicks, some with nails. Can imagine what harm the person is doing to himself. And some of those things now become difficult to treat. Some of them don't even come early, so that it now becomes worse. Those things can affect the hearing. So stay away from inserting things into the ear. Then ear infection. My ear is hurting me. Discharge is coming out from the ear. Present to the hospital on time and let's get those treated, because from a little my ear is paining me, a big deafness can start. Like I mentioned, the average good hearing aid is over 100,000 naira.
Wow.
Cochlear implantation is 6 to 7 million naira. Where is it just walking down to the hospital and having the ear looked at and prescribing a few drugs or maybe ear drop could have prevented all of that. So if somebody's having ear pain or ear discharge, seek care early. I would love to mention this. In other parts, in many parts of the world, as a child is born, they do what we call neonatal hearing screening. We're working towards that in this country too. Immediately, they want to assess the child's hearing. Can this child hear? Even at birth, the first few hours of life. It's not as if they don't have work. It's important because for somebody that has not acquired speech, it's much more difficult to treat the hearing loss. If the person has acquired speech, it's easier for you to treat the hearing loss because the person can even lip read. If I know how to speak English, even if my ears are blocked, I can look at your lips and know that you are saying bye-bye. You see some people say, read my lips. They know you are not hearing them. They say, read my lips. This is what I'm saying. So, but he's able to lip read because he has already acquired speech. So we have some patients that cannot hear. They can't afford hearing aids. They learned how to lip read. I saw a patient that was telling me, I hear better during the day. I laughed. He said, I said, you are lip reading, sir. You understand? Because he subconsciously doesn't even know that he's lip reading. So let's try and catch hearing loss early. A woman has a child and the child has not started talking. It's not that the child doesn't talk. The child is not hearing. By the time you see a 2 years old child has not said mommy, it's not as if the child has not heard. You don't say what you don't hear.
It's not like the child have any linguistic
you don't say what you don't hear. So the earlier that child starts getting care, the better for that child. So that if the child can acquire speech early, it's easier to manage such children or such people.
Thank you so much. Thank you so much, Doctor, for being on the show. Thank you for
Okay.
enlightening us, and thank you so much.